All, this is Dr. Mubin Sayyed from drbeen.com. Welcome to one more show. This is our second discussion today. This is our little random chit chat. And if you wanted, we can talk again later in the day as well. So one thing that I wanted to comment on, when you join, please let me know what did you think about this talk. Millie J says she's first today. Yes. So one thing that I wanted to talk about, and I saw Ruby says she's first as well. So both of you, I read a couple of comments yesterday, and I'm not going to answer them because I'm upset about them. Instead, I'm going to answer them from a management point of view. The comments were the following. One person, one cool bean said, when Dr. Bean's COVID is negative, why did he take medicine for COVID? That's one. And then somebody else underneath that comment said, Dr. Bean's brain has become damaged, and because of whatever taking more drugs or something, and that is why he's doing this. And they both were discussing that I am putting patients at risk as well if this is my management approach. So I'm gonna forget about the insulting parts in there. That is they want to say it that way. I usually remove comments that have insults in them, that just because I don't think it's a decent way of having a dialogue. But this one has an opportunity here for some more education for all of us, and that is this: in a community where there is some sort of a pandemic or endemic going on, the symptoms, if you see clinically of something that is similar to the endemic, then you should bias yourself towards that disease. This is a normal management approach in doctors. And for example, when I was talking with the cool beans who were managing me, majority of them said, hey, there are more cases going on in California. It is entirely possible that you may have just simple cold or rhino or something. Especially the nasal congestion is usually in rhino and less in corona, although CDC has updated their guidance to say nasal congestion and runny nose has become a symptom of coronavirus as well. So they said, the cool bean doctor said that, look, it seems like it may not be that, but we would still advise you to take that medicine. Now, on the other hand, I've been talking about this for a year as well. If you ask me now, so let's separate me as a patient from me as a doctor. If you ask me, I would say that if a society has the pandemic or endemic going on, I'm just going to call it pandemic. Pandemic means global. Smaller societies don't have pandemics, they have endemics, but this is a pandemic. So if that is going on, then if my patient comes to me, yes, if they come to me with these symptoms, I will lean towards COVID and aggressively, immediately start protecting them. This is the basic difference between a doctor whose patients end up being a long hauler or end up dying versus a doctor whose patients never end up in these situations. Touch wood, jinx, I don't want my words to become bad for my patients. This is the right approach, aggressive early treatment. So now imagine for a second, I got my symptoms on this last Friday. If it was COVID, I must have been exposed anywhere 2 days before to 5 days before. Then I went for my testing on Saturday. I got my results on Monday. So I am sick on Friday, Saturday and Sunday, and Monday I would get the results. This is actually decent enough time for this virus to cause aggressive destruction. And if, for example, if I was going to become cytokine storm patient, by Monday or Tuesday, I would have been in the hospital, regardless of what is the test result. So this is the basic problem in management at this time, that doctors ask the patients to stay at home, do nothing, and just wait it out. And if you become serious enough that you have to go in the hospital, then we say, oh, well, yeah, you have a problem. And then it's too late. So if those cool bean doctors who have been listening to this, the teachable moment here, as much as these two folks were kind of making fun of it and thinking that my brain is damaged, the teachable moment here is early aggressive treatment as soon as you see the symptoms. That's one. Number two, RT-PCR is not necessarily always correct. I have done a video about 8 months ago now. That video's title is Positive Predictive Value and Negative Predictive Value. When you get a test result, the result of the test still need to be further put in statistical terms to understand if it is really correct. If it says positive, you still have to doubt it or accept it based on what is happening in the community. And I've talked about it many, many times before as well. For example, let's say US was totally not having COVID at all. Or let's say COVID or some other unknown disease which has not even occurred would occur, let's say, 100 years later. Today, that is not there. If I come to you and I say, I think I have this disease, you would say, no, nobody has that disease and nobody has the possibility of that disease, so you don't have it. Even if I am positive for it, this is called positive predictive value or negative predictive value of a result. This community at this time is going through COVID. So taking this precaution, maybe quarantining yourself, taking some medicines that we can, aggressively managing yourself is actually the right approach. This is the approach missing in the mainstream management. And that is what is causing deaths and long hauling. So as much as I may look to you, these two cool beans, to be doing something incorrect to a point that somehow my mindset is in question, this is the approach that is the right way to work. And the benefit in this approach, there is one more, is that number one, the things that what was I taking? Vitamin Ds and K2s and things like that, they are actually good things to have. Ivermectin is pretty safe. I did not take anything else other than anti-inflammatories, ivermectin at this. So I just wanted to make sure that you call, you say that my brain is damaged. That just reflects on how you are and how you assess and articulate. I have no problem with that. But teachable movement, please, for you and for others as well. Aggressive early treatment. This disease needs even prophylaxis. That even if you don't have it, you need to take something like ivermectin or hydroxy or others. Again, with your doctor's advice, with your health, seeing this is not a prescription. But this is how important at this time it is to manage. I am fortunate that I had so many doctors at that time who were helping me, who were prescribing things, who were watching over me. There were doctors who were calling and asking, and I'm very grateful to them. And I'm very happy that I did not become more severe. Now I can look back and say, maybe it was just a rhinovirus. So that's fine. So here we are. Thank you very much for listening to my rant. But this was actually a teachable moment to say, you know what, doctors actually need to do this early on. Sandy Thompson says, Dr. Bean, you are so nice to these people. The wheel is turning, but the hamster is dead. The thing is this, we have to be careful with our patients. Yes, I get my patients, if I get those symptoms, I treat them early like this. So they were doubting that somehow I would not want to do this to my patients. I would do this to my patients. I try to get them away from hospital and ICUs and from becoming long haulers. Mahrukh says, how can we manage pregnant COVID patients at home? Which medicine can they take? And so this is a very important question. I forgot to ask Dr. Aaron about that as well. So see, the thing is, pregnant patient, hydroxy is something they can take. Ivermectin, I would never say. Vitamin D levels are important to stay corrected. Rest, hydration, symptomatic treatment. Again, those drugs that can be safe. But it is really difficult to manage pregnant women without ivermectin. And so please continue to stay in touch with your doctor and make sure that If blood thinners are needed, once again, it has to be with the child in mind. So my answer is no answer here, because this is the most sensitive part of our human community, a woman who is pregnant. And so I can't just give a general answer. So Harley says, what evidence of asymptomatic transmission for COVID-19? I've never seen evidence. Is this mythology? So Harley, this is a very interesting question. I hope you're not being cynical or sarcastic. But if you are really thinking about it, this is something that is really interesting as well, that those people who are asymptomatic, how much are they spreading? We know that the spread is occurring by asymptomatic and asymptomatic. The question is, how many of us are asymptomatic and are spreading? That is, for example, let's say I had the COVID. I have become totally cool, but we know that the immunity to COVID would develop, the adaptive arm would develop anywhere from 7 to 14 days. So maybe my adaptive arm is still not yet fully ready, and I am still maybe contagious. I'm just making it up, I'm dramatizing it. I think that my symptoms are such that I'm not contagious anymore, but I may be spreading. Similarly, there is a study, Harley, that I have actually discussed in the past. So you'll have to go 8-9 months ago and look at my videos. I had done a discussion about some people who were followed. For example, if I became COVID positive, they came to me and they said, okay, tell us everyone you came in contact. And then they went and tested them, and then they tested the people there. And so that in that study, what they found was that there were people who were COVID asymptomatic, never developed any symptom. But on their process of meeting and mingling, they had made 6-10 people sick within a couple of weeks of just meeting them. So asymptomatic transmission is a thing. It is a reality. There are studies for some people, but there are no mass scale studies, because finding asymptomatic people and then following them and then seeing all of their contacts is a difficult thing. But data is present. Chris says, I don't remember. I can't. And I have done a discussion about it. And in that discussion's description, there are links to that asymptomatic study questions as well. Keep up with med says, question, is vitamin K2 safe? Can it over-clot your blood? So K2's job is not to over-clot your blood. K2's job is to work with the calcium and the calcium deposition. So K2 and magnesium would help with the calcium mobility. It is the K1 that has primary role with the clotting. Cindy says, what is critical long hauler? That was an interesting statement in the interview. Cindy, I'll have to re-listen. Sometimes when I am looking at the next questions or commentary, I skip over some. I do not know critical long hauler. Okay, so Pasi, welcome here. You've been here after a long time. I hope you're doing fine, and I hope you're happy. Somebody had another complaint yesterday as well, that too many chit-chats and less exploration of the medicines. What I have been doing is, for the last few days, I thought that open forums used to become too long because there were people who had questions. So I have split every day's talk in two pieces. One small piece where we talk about most burning concepts, medical concepts, and then the second is a chit-chat. There are concepts that I'm going to talk about, for example, niacin or other things, which may be longer, but generally I have separated these two out. These last four topics I really thought were important. Number one, ivermectin and vaccines, ivermectin and variants, hydroxy and vaccine, hydroxy and variants. Although these were repetition of mechanisms of old time, but this was a very important talk, or these were very important talks, because so many people had been asking me those in every open forum and separately as well. So I thought I'll just build those videos so people can use them. So no, I'm not trying to not teach or not share. It's just that I've separated them, and I'm going to go back to the newer things. So what about nitazoxanide? So these are the kind of things I'll present. Niacin, nitazoxanide, the CDX24 from Israel, or other things. Free press says long haulers will benefit from ivermectin. I think so, yes. Trevor says, I like chit chat. Thank you. So Adam says, is there any impact of the weather in COVID? So Adam, I did a talk about 6-7 months ago where we discussed a study from China, where what they did was they looked at the spread of SARS-CoV-2 within China in some cold areas and warm areas. And they saw that it can actually transmit better. So it's not about winter. It's really about the transmissibility in the air, and the air has water vapors, and then based on how much is the moisture present in the air, how much in the warmth present in the air, that makes it easy for the virus to move forward or not. If it is too moisturous, if the humidity is too much, the virus cannot move easily. If the humidity is too less, virus cannot move easily because it evaporates and becomes very thin and drops. But then it also stays as in aerosol out in the environment for 2 or 3 hours. So every kind of environmental parameter has its own pros and cons. And I had done that discussion in the past. So generally, to answer your question, yes, there is a relationship to environmental humidity and temperature, but that is not just that. For example, for other colds, it is the temperature in this area that when drops, the viruses start multiplying and we become sick in winter time. This one is not in that state yet because it is still, we are free things for it. It can just enter our bodies winter or summer, but transmission is changed. Rajesh says, even your early aggressive treatment of disease was safe and not dangerous at all, and hence right way to treat early aggressive. Absolutely, Rajesh. Thank you. And I would treat my patients the same way. When I talk with doctors, I tell them as well to do it this way. This is why doctors were actually getting surprised that, hey, this is what you teach us to do. Why are you asking us what to do? And that is just my way of working with the doctors, that when I am sick, I take advice from someone instead of just my own advice. Okay, so this COVID is bat-related illness. It is a virus that lives in bats. Jana says, I got it June 18 in Florida, hot and humid. Yep, so check that out. Blitzer 55 says, what's your opinion on Ziverdo Kit? I have to read up. So there's a question, what are your thoughts about the Chinese approach to vector vaccinate, the whole inactivated virus? Maybe bigger chance of working on mutations. Absolutely. And the Coronavac from India is also the same way. It is an inactivated virus. Inactivated virus has a better chance of creating antibodies against a majority of the virus parts. So for example, if you show through a vaccine, just let's say a hand, and the antibodies are against that, although they are very effective because the virus is spike protein, that hand is important for it, but still it can escape. And if it is an inactivated virus, and then there is antibody against the head and the tail of the virus and the M protein and the N protein and the RNA and the other parts of the virus epitopes, it actually becomes more potent response. So Manafe, you are correct in saying this. Denise says zebra is our mascot. Covaxin Bharat Biotech. So Rajesh, you have now figured out that I always forget Covaxin. I think something in my brain, as the commenters were talking about my brain state. Buzz Night Gear. Dr. Bean, hello from Scotland. Asked my doctor for ivermectin and he won't prescribe. Can I go back and give them evidence and ask for off-label? If he says no, then I can bring up the Helsinki declaration. Absolutely. So if you look at my ivermectin study, so let me actually show you what to do. You may have to do tiny bit of homework, but let's do it. I'm going to share my screen for a second. So if you go to YouTube and you look up, you can look up ivermectin for anyone, but if you look up Drbeen ivermectin, wow, look at that. It is showing us live at this time. And if you look at Drbeen ivermectin, the interesting thing is that in majority of these talks, look at how many talks I have done about ivermectin. In majority of those talks, if you look at the description, in the description, you would see the links to various studies that prove its use. That is one way. Another way is to go to flccc.net. So if you go to flccc.net, here in the iMask Plus protocol, if you go to information to share with your doctor, you will have take this information to your doctor. So FLCC's review, a one-page summary, meta-analysis of various studies, iMask prevention and early treatment protocol, and so on. So they have also created an analysis of the studies. And in here, if you go to the bottom of it, they usually have the link to the studies. So these are the kind of things I do for my cool beans here, that I go over these studies, I go link by link, I read them, and then I make sense of which study makes sense and then use that. So all of those studies are here. So you can actually take this document, these studies, you can bring them to your doctor as well. So I hope that answers your question. I hope that also tells you the kind of homework I do for our discussions. Mary says, fantastic time of day for us in the UK, 8:30 p.m. Thank you. You will get a full night's sleep. Very good, Mary. I'm so sorry that you get bothered in the night. This was not on me. It is actually on Dr. Aaron. She's from Israel, and she said that 8 o'clock her time was good for us to have her. And so that was this time. Maybe we should do two talks, one talk at this time and then one at later time. Do you think we should do a chit chat at this time in the morning, and then evening a medical concept and a chit chat again? So basically 3 discussions. Troy says, Dr. Bean, I'm pissed. Leronlimab should have been given an EUA. This is a bunch of crap. Agreed. So I think I had made that comment that day as well. I think this is not a problem with the studies or the drugs or the mechanisms. I think this is more of a smaller company not being able to exert the kind of influence with FDAs and CDCs and NIH compared to larger companies. I still keep giving you this example of what is that? Bamlanivimab. And again, I have no problem with bamlanivimab. It is useful. It's a monoclonal antibody. But if you look at bamlanivimab and their study, if you look at this here, this is the approval, November 9. And if you look at the study for bamlanivimab, look at this. This is FDA. The trial had 465. Am I sharing it? Trial had 465 non-hospitalized adults. Of those patients, 101 received 700 milligram, 107 received 2800 milligram, and 101 received 7000 milligram of the dose. So that means they were all bamlanivimab. And at any time, you cannot say there were 300 bamlanivimab because they were all on different doses. That means at any one time, you could only talk about one of that group. And then the other one group was placebo, that was 156. So this study is so small that it is really at any one time 100 people compared to another 100 people. And they use this to say, good. Similarly, if you look at remdesivir, Remdesivir's efficacy, the primary endpoint was actually not met, just like leronlimab. The secondary endpoint of reducing the hospitalization time was something that they picked up and said, we approve you. That is very similar to leronlimab as well. And once again, let me be very, very clear. I have no relationship to Nader. I have no relationship to Cytodine. I have no even shares of Cytodine, for this reason that my lectures are presented as CMEs as well, and I cannot have the shares of the companies whose product I may talk about. So that's a sacrifice on my end. Otherwise, I can actually buy shares of these kind of companies, which I am looking and studying. I don't. And so without any such influence, I think that the drug is useful. I just think that it's the influence part. Simple Living says, does ivermectin affect blood work? A doctor said it can screw up random blood work. Liver diabetes is very toxic. I have not heard of that. So there is a new set of rumors about leronlimab, ivermectin, and that is that somehow it does the blood issues and blood thinning interactions and so on. Yes, it does those things, but one can monitor and it's pretty safe. Any drug taken in excess can cause these things. Ruby Zaret says, Dr. Bean, can you please ask Dr. Aaron about the Drew's uptake of the vaccine? Who is Drew's? They are highly isolated population. Okay, very unique. I would hate COVID dripping through their population. Okay, so I can ask them. Jenna says, Bambi, I cannot get on Twitter anymore. Okay. Jenna, how are you doing? So I am always curious whenever I see your name here and comment that how are you progressing? So if you don't mind, if you're okay to share it, please tell us how you are progressing. So keep up with the med says Austria suspended yesterday batch of AstraZeneca vaccine after death case. What are your thoughts? I haven't looked at it yet, but again, if that has happened, let me take it down. Maybe the batch was expired or incorrectly made. So AstraZeneca in Austria. I'll look it up. That's it, Raj. We don't have support from political person. I think that it's not just the political folks like senators and congressmen. I think it is companies have relationships as well. And those relationships pan out in these kind of times. And people, I think, have career opportunities. For example, I do not have any big pharma, small pharma relationship. I run Dr. Bean. Yes, nowadays we are under stress because of me just focusing on COVID. Still, I don't have a relationship with, for example, I'm not looking to say, okay, can I work for Cytodine? And now all of a sudden I start doing things that would help them. Similarly, somebody in FDA may want to be in Pfizer tomorrow, or somebody in Pfizer may want to get into FDA. So these large organizations, you can't stop people from having such thoughts for even in the future. And that is how these organizations kind of help each other. I had thought during the pandemic, they would stop doing this or reduce doing this, or while they're doing it, they would also let the other companies that are coming in with solutions do some things too. That is what I'm not seeing. That is what I think is the shame on them that they are not doing it. Okay, so Harley says, do you think that government is underreporting adverse vaccine reactions? So the adverse vaccine reaction, the app that is used, anyone can go and add a reaction in there. So government cannot stop us from going and looking at those reactions. So there are actually tables, you can download them, and all adverse reactions are shown there. Now the question is government looking at the deaths, for example, and then correctly attributing them to the vaccine, or listening to the vaccine company that would always come back and say not related to the vaccine. They did the same in trial as well. They're doing the same afterwards too. For me, at least one of the cases of Florida doctor, unfortunately, who died away, that is very strong evidence for me that there is something to do with the vaccine, and they simply said nothing. So there is something in there, and I think there is a way to just kind of look away. That is what is happening. Blitzer says, why are people still insisting that SARS-CoV-2 hasn't been isolated? They're mentioning exosome and they only... Look, it's just... There are some folks who just have gotten stuck to some statement that helps them, and they just keep repeating it, and that's about it. Jack says, in the beginning, I'm so thankful to your advice. I felt ready. I ever got it. And that's the point. Just stay ready and stay aggressive and stay early. This has nothing to do with the mental abilities. Staying sharp and early for this virus is very important. Otherwise, it does a number on us. So Matt says, how long does a COVID vaccine remain effective for, and can the new variants also be tackled by vaccinations? So number one, how long can it be effective? So there is a difference. Dr. Aaron and my studies, so she said that number one, original infection does not create immunity for a longer period of time. Number two, vaccine, we do not know about vaccine, which I agree with. So if we look at the infection, in the past, we have seen the infections to continue to protect people for 2 to 3 years. Now we know that there are so many studies that show the protection for about a year. And as the months would continue to go, we'll continue to observe more and keep updating that number. I think it is going to be 2 to 3 years. And because of that, I think this pandemic is eventually going to go away. One. Second, the question of the new variants. There are going to be some of these vaccines that may not tackle the new variant properly. And the reason is this. Imagine this is the spike protein. And in this spike protein, we have selected this part to create antibody against. We have selected this part to create antibody against. And we have selected this part to create antibody against that. So this is the genetic material for these parts that we have given. And now when the vaccine is given, these are the three, although the whole spike protein is given, but I'm just giving you an example for how escape occurs. So now let's say these are the three pieces where the antibody can be attacking the actual virus when it comes in. Now imagine if the virus changes the structure of this part of their spike protein. Now this antibody that was going to bind here cannot bind here because virus has changed it. And this is how vaccines can become ineffective. So, and this is why the first question, that was a brilliant question, that inactivated virus may actually have a better chance because it would create thousands of type of antibodies. So to answer your question, the variants majority can be tackled. So far, the efficacy is going down. South African variant causes too much drop in efficacy. For example, for Johnson & Johnson, it goes down to 40 or even lesser, but majority have just fallen to 70%, which can be then managed by adding the RNA of the changed vaccine. And that should be a couple of days job, and then maybe some testing and verifying and then quality assuring and sending it out. So I think that we would still be able to get ahead of this. And I saw a super chat. Thank you very, very much. Aaron says, thank you very much for your time, Dr. Bean. You're very, very welcome. Continuing, Harley says, do you think ivermectin could treat Ebola or hepatitis? They have tried it. I have to look at those studies to see what was the result and why did it not work. Of course, if it was able to treat them successfully, then they would have been using them. It has not been. But they have tried it. It has been effective, but it has not cured them. Igor says, is it safe? Igor says, is it safe to take ivermectin pills for dogs? I think, Igor, if you have been here for some time, you know that I always avoid this one question. So I won't be able to answer this. Being a medical doctor, I would always prescribe human formulated or the ivermectin formulated and tested on humans to be used. So Mike says, Dr. Corey said, you don't need ivermectin if you've been vaccinated. And that's what I say as well. You don't need vaccine. You do not need ivermectin. You do not need other things against COVID if you have become infected and recovered. I mean, think about it. You got the wild type infection. You beat that thing. And now you are saying this pill would help me or that. Although, now let me contrast it. Dr. Mahrukh said that after vaccine, when he traveled from his state to Texas, he still took ivermectin. So that means it is a matter of your comfort as well. In my opinion, once you have recovered from the virus and you have been fine, then no need. My opinion says, great doctor, great teacher. Thank you. Thank you very much. You're welcome. Helen says, Sandy, I contacted mine a few months ago, begging him to watch and show Dr. Bean to everyone. Standard letter reply, so yes to petition, send me the link. Golmuk, I haven't seen you for some time. So far, the variants have not completely escaped or ablated the vaccine. They are impacting efficacy, as Dr. Bean says, but the bigger problem is even more aggressive new variants down the line. Yes, for example, the variant in the latest variant in the US, which state was it? That has UK variation plus South African variation. So it has combined them both, which would mean it would become even more contagious. It could become even more, I don't want to say lethal, but if it goes around in the society more quickly, it might cause more people more sick. So yes, that is a problem. So Sandy says, Dr. Bean, can you ask a UK medical cool bean to start a petition at the UK government to get ivermectin license? We can all sign this. Okay, so any cool bean, I would keep asking. If somebody is there from UK, can you please talk with me and we can help put this petition together. Although I'm seeing that from UK, many people have commented under my ivermectin discussions that folks in UK are getting it from India. So there is a site where you can go and order it. Keep Up With Med says this hour is so convenient for Europeans. Maybe I'll have to do a third talk at this time. Golmuk says California. I think it is the California version. The only thing is, at this time, I'm usually working on the business things and I'm not fully ready for medical concept discussions, which I do at 6. So we can do probably a chit chat at this time, then a 6 o'clock medical concept and chit chat again at that time. Westfield says, based on serology tests of far more people infected than numbers indicate. So are we further to herd immunity than believed? I think so too. Actually, because I wanted to get my own antibody test done as well, and I wanted to go to Red Cross to donate the blood and get the test. And I was thinking, they must know the herd immunity levels because they're getting a lot of blood, and then from that they can actually see what percentage. And we are reaching near herd immunity, or we should continue to march towards that as more and more infections are occurring. Asymptomatic or symptomatic, every infection causes us to move more towards protection. I think it was the Oregon one, yes. Andrea says, Dr. Bean trifecta, a dream come true. So really, I need to do this morning one as well. Tell me if you want it, if you cool beans want it, then I'll do it. Mike says, Dr. Corey said you don't need ivermectin. Yes, so we talked about it. Det says, greetings from Alaska. Thank you for all you're doing. Stay safe and well. Thank you very much. And I do wanna. There has been so much support from Cool Beans in ways to get me coffees or to do Patreons or separately sending me donations. And I want to once again specifically thank Margaret that she has been very, very generous every month, and she has been consistently helping. So Margaret, thank you. And thank you to everyone. I was actually thinking to put the names on the Patreon. I'm learning all those ways that people do. So put the list of people on the Patreon at the end of the video to thank them. And so thank you everyone who has helped during this time. So Bob says the variants will need ivermectin. And yes, Bob, I have done a talk about ivermectin and variants. Mate says, yes, if I'm pronouncing your name correctly, yes, please, from Croatia. Okay, let me wrap my head around this. So maybe for a couple of days, I'll just have to reschedule my calendar and think about if I can do this. So just give me a few days, and I think I would do a chit chat in the morning and then 2 talks in the evening. Bambi says, is there any adverse reaction to taking vitamin C? So there are some cancers that can secrete hormones, for example, parathyroid-like hormones, which can then cause calcium level dysregulation. So in such cancers, if somebody is also taking vitamin D, then they can cause further dysregulation. So just be aware of that. For example, there are some lung cancers that release parathyroid-like hormones, which then cause mobilization of calcium. So then on top of that, if we give vitamin D more than normal, then they would get even more issues. Closet picker. That is very selfish, closet picker. So closet picker says, and I'm kidding, I prefer just one chit chat per day. I hate to miss one as I am afraid to miss something. So that is interesting. So that means, closet picker, you're saying that now you have to, today you watch one short video, then a chit chat. Now there will be one more chit chat to keep track of. So Walk says that you know Dr. Tess Laurie has done a meta-analysis and presented to you. Yes, I do. And I don't think that UK authorities, just like here, look at the FDA's statement and CNN's article about ivermectin. Many cool beans said me afterwards that, hey, you were talking about it, but really the clarity of the article is that people are taking horse paste or other things and they are causing harm to themselves. And this is why FDA wanted to warn. FDA is such a bunch of, this warning is fair and it should have said it that way. And second, the FDA should actually go approve it, or at least take a position of saying, no, we are not pro or against. So doctors can use it as an off-label. So if this is what is happening here in the US, I'm sure that such things are happening in UK as well. Carolyn, you're very welcome. So Teq says, can I omit vitamin C from the list of supplements to take along with ivermectin for prophylaxis? Worried about oxalates. Absolutely. So vitamin C's basic role is antioxidant. So if you're taking any other antioxidant, then that is fine. For example, CoQ10 is antioxidant, NSE is antioxidant, glutathione is antioxidant. So as long as you are taking care of the antioxidants, it's not necessary that you have vitamin C. Vitamin C has its own effects, but this is one primary effect. Vitamin C also causes membrane stabilization, which may not be done by others, but vitamin D can cause membrane stabilization. So Kyler says, do you think FDA should wait for USA trials for Novavax vaccine or go by the overseas trials? When it's finished, it would be a difference of 2 months. I think if there are Novavax trials outside, we should take the results and work on them. Gabby says this time is great, 8 a.m. here. So you guys are going to push me to do one more here at this time. Closet Picker says, yes, I can't afford to lose 3 to 4 hours work each day. We are addicted to cooking. Thank you, Closet Picker. So you are actually saying do less talks. Blitzer, thank you very much for the super sticker. Zigzag says, I changed the acronym FDA to something more appropriate. Yes, they have let us down at this critical time. There was a question about menstrual cycle. So Justin says, my wife wants to know if COVID has ever affected a woman's cycle. So not directly, it does not affect it, but COVID or even the thinking of COVID can actually cause dysregulation because of the hormonal changes, because of anxiety. So there are women who are known to actually have no periods just after being in stress. And similarly, women who are going through some illness or who are anxious, they may actually have delays in their menstrual periods as well. Of course, pregnancy should be looked at as the first case, and then these things can happen. Andrea, thank you very much. Doug says subscribe turn on alert makes sense. Yeah, so that should be done. That is correct. So on the YouTube, please ring the bell so that even if I come in the morning, you can at least have a knowledge that this is happening. So there was a question about 13 years old and ivermectin. Here, Debbie. Question, hello there. Can I give ivermectin to 13-year-old with possible concussion? I think I talked about this in the past as well. Concussion simply means that there is some brain tissue injury that could have meninges, the covering, inflamed as well. And if that is the case, it is possible that ivermectin can cross through that. So a concussion that occurred, let's say, a year ago, and now the patient is fine, then they have as normal a blood-brain barrier or repaired blood-brain barrier as others. But if somebody who's going through active concussion, they may have their meninges inflamed as well. In that case, it becomes bad. Maureen says, has ivermectin been used for others? They have tried it. It hasn't been as effective for many others as it is somehow became effective for COVID. So keep up with med. I have my quercetin and 500 milligram capsule, so I don't know how to regulate it as daily prophylaxis dose is 250. So check out the bottle. Of course, they would not put anything in there that is an overdose. So check out the bottle and see what is the daily recommended allowance percentage they have covered. And if they have covered the daily recommended, then doesn't matter if it is 500 or 250, because sometimes there are extra substances in there. It is the amount of quercetin itself. And then if it is within the daily allowance range, that is fine. We actually get so much quercetin when we eat red skinned vegetables and fruits and onions and things like that. So again, Julie, I cannot directly talk about any one patient, so I'm going to just talk hypothetically. My hubby has TBI, traumatic brain injury with epilepsy. Can he take ivermectin as a preventative safely? So once again, any patient who has active inflammation or damage of the blood-brain barrier should not take it. And that is because it can go to the brain, the ivermectin, and attach to the neurons there and cause permanent damage. Now, the epilepsy or TBI definitely, traumatic brain injury, definitely means there is a brain injury and there would be inflammation, and that would mean there is some compromise of blood-brain barrier if it is an active state. The epilepsy is really more of a electrical activity within the brain tissue more than the indication of inflammation, although inflammation causes epilepsy as well. So without knowing exactly what is the current state, what is the state of the meninges, if I just heard about it from a theoretical point of view, I would say, well, there is a possibility of inflamed meninges and ivermectin should not be taken. Maureen says, I'm so glad I found you, Dr. Bean. Thank you very much. Welcome. So Jack says, why would an ivermectin prescription be withheld if hydroxy was prescribed in the past? The thing is this, that even hydroxy has a similar debacle. There were issues there as well. I think that ivermectin is having a little lighter time compared to hydroxy. Just let me send a text message. I had a meeting. Mike says, fully vaccinated Americans can gather indoors with other vaccinated people without wearing a mask, federal health officials said today. And that makes sense. Bert says, question, does 5-hydroxytryptamine have the same effect as melatonin? No. 5-hydroxytryptamine or serotonin is really something that would help balance your mood, keep you excited, keep you alert. It cannot do what melatonin does. Melatonin helps with your sleep cycle plus anti-inflammation and especially mitochondrial balance, which is necessary to reduce the cytokine production, especially in COVID-like thing. That is what serotonin does not do. So LG says, can I take Wellman tab daily if I am taking vitamin D 20,000 IU weekly and vitamin C? So of course I cannot answer your question for you, but I'll answer about mine. I take a daily multivitamin for men, just so that I have all the right vitamins in daily RDA. And then on top of that, I take 10 or 20,000 vitamin D as well. So Teq says, how long should I do prophylaxis? So Teq, normally the concept of prophylaxis, again, not talking about you, the concept of prophylaxis is to protect yourself as long as possible, or protect yourself when you are in highly exposed situation. Now, for example, with COVID-19 prophylaxis, I usually talk about when I talk with my patients, I say that till you get vaccinated. And if they don't want to get vaccinated, then for a longer time, they'll have to continue to take it till the virus disappears from the society or becomes adapted. But they would stay at risk. Joer says, after splenectomy and removal of the lymph nodes in the right axilla, may one type of vaccine be better than the other, as it is mode of action in the body and the immune system? Thanks, Love from Germany. So Love, back to you as well. Vaccine, of course, there is the macrophages and dendritic cells. A lot of them live in spleen and take care of many of the bacteria. In case of vaccine, it really doesn't matter, because all vaccines at the end of the day are going to come and start bothering the immune system in the local tissue, and then go to the local lymph nodes and bother the immune system there. And then those cells are going to go everywhere and just go and sleep in various places in the body. So it doesn't matter. Blaze says, do you think ivermectin affects the cytokine storm? If so, what do you think it is doing from pathophysiological standpoint? So I have done that discussion. Do you know that I have another tiny, what is that, YouTube channel? I can't even find it when I search for it here. So if I say ivermectin, how does ivermectin work? And I have to actually write Mubin Sayed. Even then, YouTube yet does not bring it up in the top, but here it is, finally. So this is a different channel, but the answer to your question, I'm going to give you that answer here as well, but let me just share this in the... There are 5 people who didn't like this. Give me 1 second. I'm going to share this link. And I am pasting it here. So I just shared that link. So Blaze, to your question, how does it function? What ivermectin does is that one part of this is reduction in nuclear factor kappa B pathway. That pathway is responsible for inflammation, and that pathway is then responsible for activating the other cells as part of the inflammation. So because it suppresses that, it generally causes reduction in inflammation. Caroline says, I had a hard time. Yeah, so what happens is YouTube does not trust your videos in the beginning. And the reason is, so now I'm going to give us a YouTube lesson. So what happens is, for example, let's say if I go to YouTube and YouTube shows me this, whatever this is. So YouTube has somehow figured out that this is a small space. In this space, YouTube has to try to put something in front of me that I would really like, and I would hit play on it. And so then they can run an ad in front of me and then go and charge the people for the ad and earn money. So they cannot take a risk here of putting something in front of me that I will not click. Because of that, they would put those things that are tried and tested, or those things that I have liked in the past, or those things that I've watched in the past, or those things that other people like me have been watching and liking. That is what they're going to bring here. And then that is what they would think I would click. So my Dr. Bean, that video that I just showed you, that video is coming from a channel, this one, which only has 600 or 700 subscribers. Plus, it has a topic on it, which now there are 5,000 or 6,000 views, but it is not a viral kind of a video. So because of this, when you search for this kind of a topic, they don't trust this video to earn for them. So then they don't really show it. And then slowly they would develop their confidence and keep showing it to some people. They would click it, then they'll say, okay, I can show it more. And this is how YouTube works. Nader says, question, do you think that the long-term exposure to high level of oxygen in COVID treatment is contributing to the long-term damage to alveolar epithelium? I am referring to oxygen toxicity. So Nader, if we talk about the toxicity itself, then you are already kind of putting your answer in the question that if you're causing toxicity, then of course there is damage in there. But the problem with the in the case of COVID, especially I'm thinking about hospitalized patients, their oxygen levels are actually very much down because of their alveoli that are filled with fluids and pus and broken cells. So in them, giving oxygen is very important. Nancy says like button. Yeah, so the way those videos, and I have to do more here, the way they would become more popular, or YouTube would become more courageous to show them, is when more people have liked them, when more people commented there or shared, and when I have put some more content out. Then YouTube would think, okay, we can take a risk on Mubin. Simple Living says, what is black seed oil good for? What are the benefits? A full video and a beautiful video has been done in the past. Simple Living, it is especially useful in the prophylaxis of this COVID as well. Ali G says, I'm not sure, but I think search engine optimization is, yes, of course. So I am but one person. How many things would I do? So Gabby says the prednisolone has helped me a real lot. It seems to go in waves with post-COVID syndrome. And I have always used steroids to actually take care of the long haulers. Hi says, do you recommend omega-3? Absolutely. I take omega-3 and I recommend them as well. So if you see, although somebody, so Cool Bean always, I love them in this way that they always have their own commentary to like or dislike what I'm doing. So I had shared a few days ago the supplements that I take, and I don't know where it is, the picture. I was going to show you the picture. In that there is omega-3 as well. I can't find the picture. And somebody had said that, hey, you are taking so many things, these are useless. Actually, I have discussed every single item's mechanism of action, and that has been in the past. So Don says, what if you have long hauler symptoms months after recovery from COVID? Would ivermectin help? So Don, I have seen a couple of things. One, I've seen some long haulers saying, I take weekly 1 dose of ivermectin and it is helping. Secondly, I've seen that folks with ivermectin and steroids is helping as well. I would always first give a low dose therapy of steroids, and then I'll probably maintain it on ivermectin and then hope that it actually goes away. Sapal Steve says, I read that people can be infected with more than one strain of the virus. Does this matter much? Would it lead to more mutations and transmissions of the virus? Thanks. Actually, number one, yes, it can happen. And number two, even when we are infected with one strain, in our body, we are coming up with millions of species of that, not species, variants or mutations of the virus. It's just like, when our babies are born, human babies, they all have different face, although this structure is the same, the 2 eyes and nose and mouth, but they still have a different face. Similarly, when viruses are being formed, they're all slightly different. Because of that, there are so many variations, and we can just attack them all and kill them. So if some other variation comes from outside, we are least bothered about it. We may become a little sick for a few days because it escaped our previous antibodies and now still damaging our cells, and then we took some time to develop immunity to it once more. But for the majority of that part, we will create antibodies and we will tackle it. So not too worrisome. If somebody has already become recovered, they are pretty safe. Yes, they may develop infection. There are some people who are developing full reinfection. What I still do not know is the pathology, that do they have a problem with the immune system, or did their antibodies just went away very fast, or their memory cells were not formed, or is there vitamin D that is not correct? What is the actual imbalance is not known. But that is rare. Mostly we can handle these things. Moonshot says, smash up the like button for a favorite doctor. Thank you very much. JRG says, what is considered to be a high load exposure? WHO's definition is a doctor's clinic's living area, sitting area for 15 minutes. If there are COVID patients, that is what they call high load. So of course, there is no exact count. So that means what I would say is staying in an environment where there is COVID in the air for 15 minutes gives you enough load to become sick. Thrill says, okay to take low dose 5 milligram prednisolone before vaccination. It doesn't have any, it doesn't have a huge effect, but this is something you should talk with your doctor, because steroids are going to suppress the immune system for some time, a few hours. And I do not know what would happen with the vaccine's immune needs. Although they have given vaccines to autoimmune people who have been taking steroids. Cool. So how about we break for now? This time is interesting. Dwee says, are you safe if your first infection was very mild? Yes. So imagine, let's say for my case, it was actually COVID. So there are two things that happened. Number one, I could handle it with mild symptoms. So do I get bothered if it comes in to my body once more and causes infection? No, until the variation is so severe that it just has become a monster. I don't think it can become more monster than what it is. So let's say my immune system didn't bother, so I'm fine. If it arrives in my body again, fine, I'll take care of it. The second thing is I get protected now as well, because my immune system has developed antibodies against it. Again, that is provided that I had the COVID. So those who had the COVID and then they didn't even bother about it, that doesn't mean their immune system didn't take care of it. Their immune system took care of it in a beautiful way. And when it arrives in them again, it would take care of them again. I have said it many, many times that the difference is, let's say from point A to point B, from January last year to January now. I got infected, let's say January of 2020. Now is January of 2021. During that time, imagine if the person has developed some sort of immunosuppression, cancers or bone marrow issues, or they are taking steroids, or they are taking some other reason, there is an organ transplant. So if their health has become different, then they may need to be aware of the issues. Simple living. How often should we wash our hands? I think that if you are inside the home for the whole day, don't, other than using the restroom and it is really when you go out and you're exposed is when you sanitize and wash your hands. So should we now skip the second time today and just meet tomorrow? Kyler says, would you not get one booster shot? So imagine I'm completing your question in my head that you're saying if you got infected. If I got infected, I would not need a booster shot. So there is a problem in the medical community at this time. And that is some doctors, majority of the doctors think that the immunity disappears after 3 months. This was an incorrect study by one of the early scientists who said that the antibodies disappear. These always disappear or reduce after the initial infection, but the memory cells are present. And because of that particular study, people have in their head that somehow after 3 months there is no more immunity, and they say, well, get a booster dose as well. The studies have shown that up to a year of immunity is present, and I've talked about it, and the links are in the description of those videos. Plus, SARS-CoV-1 had protected immunity for 2 years and declining from 2 to 3 years. So do we really need a booster dose? Once again, the booster would be needed if my immune system has become upset or if the virus has become a variant. Thank you. Gabby says, where are you? Which country? So I am sitting right now in California, USA. Beautiful day out there. And I am in Cupertino. Sepa Steve says, take the night off. So I'm going to skip the evening time today. Thank you, Andrea. And we would see each other tomorrow. Thank you, Al. Sepa Steve's idea is great. Hit the like button and ring the bell. Cool. Just looking at. So there is a Sandy Thompson says, petition is now live. Can you please ask everyone to sign the petition? So please, guys, sign the petition. I thought that US was doing bad. UK is doing bad as well. So let's help if we can. Thank you, Corey. Okay, so rubies are saying, no, go on tonight, and one people you are shifting your timing. No, so I'm not going to shift my timing. Just for tonight, I would skip it because I had announced before that I would come in the morning. But rubies are right. Maybe I'll show up for 5-10 minutes. The thing is this, I show up for 5-10 minutes and it always becomes 2 hours. Yes, Golmuk, I'm going to go get some vitamin D. Thank you, Paul. Cool. Cool. So thank you, everyone. And in the description, number 1, please like, subscribe, and share. And number two, in the description, there are 3 links. There is one link to buy me coffees, and there is another link to become my patron. I think becoming patron is really interesting. If you can support this work for a longer period of time, we can do this for healthcare professionals and students and kind of enable them to protect others better. So this is your contribution back to humanity to help them to have better patient outcomes. And then there is another link in there as well. That is just if you just wanted to support this work. So thank you very much. And I would come on live this evening for a few minutes and then go off. I know it's going to become hours, and then I'll see you then. And Pasi, good to see you again. Bye-bye for now.